afternoon, everybody. We're going to go ahead and get started here so we can stay on track with our time this afternoon. I'd like to welcome you all again to the City of Denver. We're so happy to have you and to have this symposium being offered for the second year in a row. My name is Danica, and I'm the director of our Public Health Inspections Division in the Department of Environmental Health. And I think the way we're going to do this is our panelists will introduce themselves as we go through the panel talk here. So with that being said, I will go ahead and get started. The Denver Department of Environmental Health has 5 different divisions with about a little more than 200 employees. And so the divisions are up there. I'm the director of the last division at the bottom, the Public Health Inspections Division. In the Public Health Inspections Division, we are responsible for enforcing various chapters of the Denver Revised Municipal Code as it relates to regulated industries in the city and county of Denver. So we have 2 sections in the Public Health Inspections Division. Our Healthy Families, Healthy Homes section, which includes child care inspections, body art facility inspections, noise complaints, swimming pools, and residential health, as well as childhood lead poisoning prevention. And then the other section, our food safety and marijuana section, which until recently was just called the food safety section. Over the last couple of years, though, we have tweaked that name to better represent how we're spending our time and efforts these days. In the Public Health Inspections Division, we have about 50 employees, and they're split roughly in half over those 2 sides of the house there. So rewind back to 2009, 2010. At that time, we started to see some storefronts pop up in Denver for selling medicinal marijuana products. And Denver is somewhat unique compared to many other jurisdictions in Colorado in the fact that we have our own food safety regulations, the Denver Food Establishment Rules and Regulations, and we also operate off of Home Rule Authority. And so we definitely have, with certain elements of our programs, different approaches than some other locals around the state. So in 2010, when we started to see the proliferation of these marijuana storefront businesses and manufacturing locations that were just starting to pop up, we made a decision at that point in time to regulate those businesses using our food safety regulations for applicable businesses. Obviously, not all businesses would be regulated if they were just making smoking or vaping products under the food regs. But for those businesses that do make food products, or really anything that's ingested, like food or drink, those are the businesses that we applied our food safety regulations to. And since that time, we've conducted at least 2 annual inspections for each regulated facility. We've investigated complaints. We conduct environmental health plan reviews to look for conformance with our food safety regulations. Denver was the only jurisdiction in the state for quite some time that was conducting food safety inspections of these businesses. Certainly when you think about the types of products that we see, we have such a diversity of ingestible products, everything from more traditional candy type products to things like ice cream and pizza. And even in the past, we've had businesses try to market canned marinara sauce that is infused, salad dressings that are infused. So quite a bit of diversity with the types of products. And for anybody with a food safety background, when you talk about canning products, modified atmospheric packaging of products, there are certainly food safety concerns that we want to control for. The marijuana ingredients or derivatives that are in these products do not negate the potential for the same types of foodborne pathogens that we would normally be concerned about. When we conducted these inspections, we used our regular food safety inspection forms and our same staff that conduct other food facility inspections. And so we were able to absorb that workload across our staff. Very quickly, as we started to work with the marijuana industry, we realized that there are some big differences between the marijuana industry and the food industry. That probably is somewhat self-evident. But the innovation that's occurring in this industry at least from where we sit, appears to be tremendous and really incomparable to other regulated industries that we work with. During the course of going out and conducting these routine food safety inspections, we started to see more and more concentrates. And at first, we really didn't understand the public health significance of what these concentrates, of the potential risks that they presented. But as we started to see them more and more and asked a lot more questions, we came to understand that these are plant-derived oils. Concentrates are made using a myriad of different processing methods, and in fact, there are probably no two businesses that can conduct their extractions and concentration processes exactly the same, or at least there's a tremendous amount of variability with how concentrates are made, and then those concentrates can be smoked, vaporized, added as food, used as tinctures and drops put under the tongue. And so this was also a little bit of a mind-blowing thing for us as well, because we just didn't see products, we didn't have a comparison for other products that really crossed lines and could be ingested in so many different ways. Dealing with these plant-derived oils, we became concerned about the concern for Clostridium botulinum spores and potential growth and intoxication that can happen. So anytime we have a plant-derived oil, the food code, whether it be our local code or federal code, is typically identifying those as products that should be either temperature controlled or there should be some other control in place to prevent for this risk of Clostridium botulinum spores. So CBOT is the short version of Clostridium botulinum, and that is the organism that causes botulism. So it is a very concerning organism from a public health standpoint in the fact that it has a high fatality rate if somebody does get botulism. And dealing with such a variety of products that are made in so many different ways, we did not feel comfortable assuming that this organism did not present a concern. And there's still very little research out there on this, but the decision that we made a number of years ago was to treat any ingested or products that are being marketed for ingestion that are plant-derived oils, including marijuana concentrates, as what we call a potentially hazardous food, meaning they needed to be temperature controlled for safety. And so that was a big change when we first implemented that, and I think probably confused a lot of folks, although it's been a number of years now, and we seem to, at least in Denver, have a pretty solid understanding of the requirements around those plant-derived oils. We did create a handout for industry, and this is available on our website still. I should have put the web address up here, but it's denvergov.org/food safety is where you can find this. So this handout really goes into the concerns that we have and the different control methods when we're talking about production processes for hash oils and other concentrates. So January 2014, legalized recreational marijuana went into effect. We continued our food safety inspections at about the same rate, but we really started to see, first of all, the business or the industry burgeoning and growing a lot in Denver, as you'd expect. So more locations opening up for us to regulate. And we also started to receive a lot more just referrals and complaints and in some cases, concerns forwarded to us from other agencies. And this is where our integrated management approach was really a tremendous help in being able to have really seamless communication across city agencies that facilitated effective partnerships. So, every time for any of our inspection, our regulatory and enforcement programs, whenever we receive a complaint, we always investigate that complaint, provided it's something under our jurisdiction. So we did have an increase in the number of complaints we were investigating, some of those related to mold on marijuana products, some illness complaints, and certainly not at rates that are disproportionate to the regular food industry. So I don't want to represent that there were more complaints than other industries, because I don't think that's the case. Over this, 2014, 2015, we really began to get a better understanding of the types of products and processes the associated hazards, and really just the variety of products out there and the speed of innovation of this industry. A little bit about our enforcement authority. So we do have some broad authorities under the Denver Revised Municipal Code. Chapter 23 is a chapter that promulgates our food safety rules and regulations, and Chapter 24 is called Health and Sanitation. And it really gives us, as a local public health agency, a lot of tools to address public health concerns when they arise. Our investigators are badged and can issue criminal summons. That's a tool that we don't have to use very often, but does come in handy under certain conditions. We assess administrative citations for repeat violations of the food code currently, and we have citations in a few of our other programs too. So certainly some marijuana businesses, through our food safety inspections, were subject to administrative citations. Food disposals, facility closures where imminent health hazards exist. That's another authority we have. And then in 2014, we had the opportunity, if that's the right word, I'm not sure if it is, to oversee our first product recall at a local level. And so that was really an unusual and groundbreaking thing for us here locally. A lot of different inspection challenges. I've already mentioned the innovations, and that certainly continues to be a challenge, but also I think one of the fascinating things about this industry is staying abreast of developments and really having an understanding about what those processes entail and where the associated hazards are. Unapproved equipment, guess what? National Sanitation Foundation and UL, Underwriters Laboratory, they don't have approvals for marijuana equipment. That, again, is probably self-evident, but when we look, a lot of the standards that we use in the food code talk about equipment that is approved for commercial manufacturing specifications. And so we lacked those standards, and the industry definitely had a period of time where they were trying to find equipment that suited their needs. I think there's much more consistency now with the equipment that's being used. And I'll talk about a particular scenario that resulted in a recall in just a moment. Other inspection challenges on the department side, the health department side, is establishing standardized policies that prioritize the health and safety of our investigators. Safety, I will talk about that in a few minutes as well. Complex supply and distribution. It took us a while to understand the complexity of some of the supply and distribution processes. And they tend to be much more complicated and have many more kind of arms reaching out than regular manufacturing processes and other industries that we're used to. It's not uncommon to have a large infused product manufacturer that might buy marijuana plant trim from upwards of 100 different cultivation businesses. And then sometimes those products are sold back to the cultivators for their storefront. Sometimes they're turned into concentrates that are then wholesaled to other infused product manufacturing businesses. There is just a lot of complexities with how that works. And the relevance to us kind of came later as we started doing more recalls due to pesticide contamination. It became very complicated, and we had investigation legs that kind of stuck out in many different directions as we worked through those complex investigations. Staffing is always a concern when we're talking about taking on new programs, and so that's something that we have tried to be strategic about as well. And then communications. I don't think it's any secret that marijuana has some appeal with the media, and so we found ourselves with an astronomical increase in the number of media requests that we dealt with over the last couple of years, and really had the opportunity to develop our own expertise within our agency to work with the media, probably with a little bit more freedom than some of the other divisions in our department. So I mentioned investigator safety. This really continues to be one of the most important things that we look at. We do feel at this point that we have a lot of good controls and systems in place for safety. And we've worked with our risk management agency. They've put together an awesome safety training video for all different city staff that might be going into different types of marijuana facilities, and that's available on the city's website as well. At first I think we had a preconceived notion that the types of safety issues we might have to be most concerned about were more criminal concerns. And that really did not pan out. I think all of my staff, as they go out and do inspections, their own personal safety due to criminal activity is not something that stays high on the radar, because it's just, that there's a lot of controls in place in most of these facilities and a lot of security measures that are in place. We certainly have concerns about explosions from concentrate production, and there's been, again, a lot of progress the last couple of years in that area as well. Potential toxicity in the environment from hydrocarbon concentration processes, so potential pooling of propane, butane in environments. And then something that is maybe less of a safety issue for us, but probably on the industry side, a big concern is cross-contamination between grows. And so we've implemented a number of policies not only to address the needs of our staff, but also to try to respect and accommodate and preserve business concerns. And so if there's a situation, first of all, we try to make sure our staff are not going into multiple cultivation facilities on the same day to prevent the possibility of pests and powdery mildew and other concerns, cross-contamination concerns, being tracked from one facility into another. On the rare chance that we do have to go into a second cultivation facility in a single day, we do tie Veg up for that, although that happens pretty rarely. Consumer safety issues. I think we're still learning a lot here. We don't have all of the answers yet. So if you guys could just kind of take what you learned today and go back to your respective jurisdictions and figure it all out, fill in any gaps, and we'll borrow it right back from you, that would be great. So with consumer safety, I think one of the biggest things to keep in mind is the value of this plant really drives some decisions that get made about how it's grown and harvested and handled, more so than other industries, because in other industries you don't have very many products that you're growing that are worth $1,000 a plant. And when you're talking about values like that, there is a financial and economic incentive to get as many plants in to an area as you can, because you're going to make more money that way. And so that tendency, that factor there, I think has influenced some of the consumer safety issues that we've seen, especially those tied to pesticide contamination. Solvent grade is another concern. So when businesses are using solvents to derive concentrates, there are requirements in state regulation about the types of solvents that should be used. But in spite of that, we're seeing a trend of some businesses resorting to industrial grade solvents that may have more concerning contaminants and carcinogens, toluene and benzene, and some other compounds that do present very real public health concerns. Heavy metal absorption in plants is another potential concern. There's not a lot of research that I'm aware of out there. I think there may be a little bit underworks right now. So we haven't identified any contamination or product from this, but it is an issue on our radar. Nutrients that are given to plants being another one that falls into similar categories. Off-label pesticide residues are probably the biggest contamination and consumer safety issue that we're dealing with right now. And I'll talk about that more in just a few minutes as well. And then unsafe equipment for food and smoking production. So, we were going along doing inspections, 2014, doing rec inspections, and started to have our first concerns about pesticide contamination in early 2015. And Marley Bordovsky with City Attorney's Office, who's speaking next, will kind of go into some detail on that. So I'll save some of those juicy details for her. But we worked through contamination enforcement actions and hold orders in a number of cultivation facilities. And then in August 2015, the Denver Post commissioned tests of infused products and concentrates that were actually on store shelves. And up until that point, we had really only dealt with this contamination factor in raw plant material. So we knew that there was probably downstream impacts as well, but we really, had our hands full just, dealing with what we'd already come across and had been referred to us at cultivation facility level. When the Denver Post conducted this testing, they found a few of the products that they tested had very high levels of off-label pesticides. And when I say off-label, we learned very quickly that the label is the law, and also that the Colorado Department of Agriculture has exclusive authority over the application of pesticides. And so we had to be very clear that the nature of our involvement was dealing with contaminated products, and we were not enforcing against pesticide use or application. We were enforcing against contaminated products that presented a consumer health concern. So this really, that Denver Post piece kind of opened the door in some ways because we had to follow up on their findings. We had to conduct investigations based on their results. It really kind of launched us into a new chapter of the work that we were doing. And we started to find that there were a lot of players in the industry that were using off-label pesticides. And I don't think that the intent was necessarily to be irresponsible or to, potentially harm customers. There was really just a lack of knowledge about pesticide laws and safety. And so we've seen a lot of changes in the industry since we really kind of dug in and have all worked together to better understand what these concerns are. Since September 2015, the Denver Department of Environmental Health has overseen about 24 recalls due to pesticide contamination, impacting over 300,000 units of product. 1 recall due to unclean equipment, and 2 due to shelf stability concerns of a product. We have weathered several lawsuits and petitions before the Board of Environmental Health, and again, I'll defer to Marley on those pieces. Just some numbers to look at with the recalls that we've conducted. This is the percentage of recreational products versus medical products, so you can see that the majority of the categories of products that were recalled were medical. So obviously concerns there when we think about consumer safety in those populations. Excuse me. This, I think, is a particularly meaningful slide from a public health standpoint when we look at the fact that the average number of off-label residues on recalled products was 3. So when we think about pesticides, there aren't any evaluations, or there's been very little evaluation done on pesticides for ingestion through an inhalation pathway. Most pesticides, and this all occurs at the federal level through the EPA and other federal entities, but most pesticides have tolerances set based on ingestion, so eating. So when we think about the public health significance of pesticide residues on marijuana products, there are a lot of concerns because nobody has evaluated what might happen when you're mixing different compounds together, some of which, none of which are, have been tested on that type of product. Some of the compounds that we see explicitly stated ornamental use only. And so that's because of, potential human health hazards tied to those products. So you think about, what could happen when you mix these compounds that were never intended for ingestion, you burn them in some cases, and you have secondary derivatives from the burning. There's really just no body of knowledge that helps us understand what those potential health impacts are. And so there's a lot of work left to be done there. Why do we care? Well, I think that, for those of us who've worked now for a number of years with the industry, it pretty quickly loses its novelty and it becomes, another industry that you work with. And we want to support the marijuana industry just as we would any other industry. And part of that is kind of some, occasionally some tough love, trying to make sure that industries are conforming to, standards consistently. So, I kind of see it as us supporting the marijuana industry, that we were applying similar types of consumer safety standards in the marijuana industry to other industries that we work with. When you think about the potential of contaminated marijuana, to be a confounding factor in long-term studies. It's a huge kind of aha moment. I mean, people looking at long-term studies of the health impacts probably aren't getting, marijuana tested. If they're tracking a long-term user, there's not going to be any information about how much of that plant material or derivatives is contaminated. And so this has the impact to be a tremendous confounding factor when we try to understand what the health impacts are of marijuana products. And then finally, and this I think is what a lot of us at the health department, what we think about and where we really feel responsible. There are a lot of folks who are using marijuana products therapeutically, including a lot of families moving to Colorado to get treatment for children who have seizure-type disorders. And so, certainly there, we have a big concern about those consumer safety pieces and the safety of those populations. Excuse me. This chart here, I'm just going to spend a minute on it, but it looks at the pesticide contamination or pesticide quantities on different types of concentrates and leaf. Can I have you turn my mic off for just a minute so I can cough? Thank you so much. So really the significant factor here is that we have some products that are testing like off the charts in terms of their contamination levels with off-label pesticides. This is a chart that's out of Oregon and it was put together by the Cannabis Safety Institute in a white paper. Where are we now? We are seeing some changes in the trends in our investigations. So when we first conducted these investigations, we were seeing lots of high-level contamination on the raw plant material. Generally, we see much lower levels now. And so that indicates probably the potential for environmental contamination of plants. So if I used to use off-label pesticides in my grow facility and I've stopped, there are going to be potentially some contaminated surfaces, walls, ductworks that could recontaminate new plants or clones that go in there. We still do see some investigations where we have strong evidence of more recent pesticide contamination. And so I think, again, those economic factors play a big role in, if push comes to shove and somebody's looking at potentially losing a crop due to powdery mildew, and the organic legal compounds aren't working, I think there's some strong incentives for businesses to resort to those other off-label tools. And then right now, we're currently working on 2 unrelated investigations where hot plant material, and when I say hot, I'm talking about pesticide contamination with off-label pesticide residues, was tested by the it was grown by a cultivation facility, sold to a manufacturer. Manufacturers have often started testing their incoming trim to help deal with this. And in these 2 unrelated investigations, the infused product manufacturers found that the plant material tested hot, sent that plant material back to the cultivation facilities, and these 2 cultivation facilities then turned around, it appears, and resold that contaminated plant material knowingly to other businesses that did not test. And so the climate has definitely changed in that we're not, in the spot we were 18 months ago where we were just learning about this all together. We know a lot more now. And so, enforcement-wise, we are kind of going to be handling these cases a bit differently moving forward, since at this point the word is really out there and people are aware of this as a public health concern. I think this is Marley now. So I will turn it over to Marley. Thank you very much.
Can you hear me? Okay. I'd like to welcome you for coming here. I really think you're doing, if you're from other jurisdictions and this is heading your way, you're doing the right thing by, as Andrew said this morning, peeking around the corner to see what's coming. My name's Marley Bordovsky. I'm an assistant director in the prosecution section of the city attorney's office. I'm a career prosecutor. I was a Denver DA for 10 years and then a DA out on the Eastern Plains, which is a more rural area of our state. And now I've been with the city attorney's office for almost 6 years. When recreational marijuana was passed by the voters in 2012 and we rolled it out commercially in 2014, it became very clear very quickly that marijuana, issues surrounding marijuana touched every agency in the city. And in the city attorney's office, we have sections of the city attorney's office that advise different agencies in the city. But it became very clear that we needed one point of contact, just to have a consistent voice about marijuana issues, that we were advising agencies consistently. That became me, and it was just me for quite a while, for the first full year of 2014. It became clear to me very quickly that it was way more work than one person could handle, and I now have a full team of 3 attorneys besides myself and a paralegal that's all they do is marijuana issues. From advising Danica's teams to excise and licenses, to fire, to the police, every agency in the city. So we're very busy, but that one point of contact has been extremely important. And if you're kind of thinking about your regulatory structure, I would urge that you think about that for your legal representation, that you have a one voice in your city attorney or county attorney, whatever level of government that you're at. I know that we used the pesticide issue as kind of a case study at the presentation last year. I'm going to use it again this year because if someone had told me last October that we'd still be dealing with it this October, I would have taken that bet because I figured people would stop using pesticides. And I hate to say it, and Danica's kind of talked about the trends. I hate to say it, but it's not going away. People are continuing to use it. Danica touched very nicely on why those incentives and why that might still be happening. Why is it still here? So I'm just going to talk about it from a legal perspective. And think about also your laws. In Colorado, we have very specific, I call them swim lanes, but areas of jurisdiction that we have been very conscientious of as we navigated this. Between us, the state, and the feds, and it's probably that way in your jurisdictions as well. I know that every state is set up differently, and different local jurisdictions have different enforcement authority. Some not as robust as Denver, but you may. So just kind of see what you have, and maybe that's something you need to think about as well. So how did we stumble into this world? So the way that Denver's regulatory structure is set up is that a lot of and you'll hear this over the next couple of days, a lot of our inspectors from multiple agencies, fire, Department of Environmental Health, excise and licenses inspectors, inspect these places and are in these facilities multiple times a year. So we have eyes on what's going on inside these facilities. Denver Fire, the fire prevention section, does 2 inspections of every marijuana businesses every year. So think about that. Ashley said this morning, there's over 1,000 licenses in Denver operating out of about 450 locations. Think about the number of inspections. But the good thing about that is we have eyes on and we can see if something is happening that should raise some antenna for us as a city. That's what happened with pesticides. So fire started noticing these concerning pesticides in these facilities with labels that said for ornamental plants only, right? You're not supposed to eat plants that you're using these chemicals on, or for greenhouse use only. In Denver, marijuana can only be grown indoors, so we have warehouses that are our marijuana grows. There was a concern if it's greenhouse use only, these are warehouses, they shouldn't be using these in our warehouses. So that's where we first started kind of digging into this. What does this really mean? We didn't realize how many layers of this onion we were going to have to pull back and how big this was going to get. But warehouses under the federal code, and a lot of pesticide law is federal. Most pesticide law is federal. It's a very complicated law. I never thought I'd be dealing with pesticide law. But because it really resides with the federal level of government, the EPA, we weren't going to get help from the federal government, right? They're not going to be stepping in on a marijuana issue, so what authority did we have? Under the federal, the CFR, warehouses do qualify as greenhouses, so we learned that pretty quickly. And we learned very quickly that there's some exclusive lanes of jurisdiction. Pesticide use and application is the exclusive jurisdiction of the Colorado Department of Agriculture. That may be also true in your states. So check it out. I'm guessing that the EPA in your state also delegates its authority to your state Department of Agriculture. So if you come from a municipality, you need to think about, okay, what is my jurisdiction that's not going to encroach on the state jurisdiction? We also learned that the state's jurisdiction is over the use and application of pesticides, and it stops there. So if you're using a pesticide off-label, they can tell you to stop, issue you a cease and desist order. What they can't do is anything about the contaminated plants once you use that pesticide on the plant. No jurisdiction over the plant itself. That's normally where the federal government, again, would step in. The USDA would take jurisdiction over the plant if it's a corn crop and make you destroy that crop. USDA isn't going to step in this case because it's federally illegal, so they're not going to get involved. Who had jurisdiction over the plants themselves? We felt, and Danica's team felt, as soon as she got information that this contaminated substance, product, was being released into the stream of commerce and going out to consumers, she had a duty to act to protect public safety. But could we? Think about also, and Danica touched on this, the routes of exposure. That's what it's called for pesticides. So if you eat an ear of corn, the route of exposure, if there's any pesticides on that corn, is through your digestive system, through your liver, and that's how it's entering into your system. How many ways are there to ingest marijuana? I've learned way too many ways over. There are some interesting ways that people introduce marijuana into their system, and it's not just through your mouth. So you can eat it, you can smoke it, which also is a chemical reaction called pyrolysis that impacts onto the pesticide, and that can turn the pesticide into a whole different chemical. There's putting it on your skin, putting it under your tongue, putting it in other places. There's a lot of ways that this stuff can be introduced into your system. And when I say stuff, I'm not talking about just the marijuana. The pesticide that's on it is getting into your system that way. So if you're smoking it, it's not being filtered through your liver, it's going right into your bloodstream. When you eat it, it does go through your liver, and the pesticide can be filtered that way. But there's so many routes of exposure that a lot of times, the EPA is the one that normally would register pesticides for use on a crop, and they take those things into consideration. What is the way that this pesticide is going to get into the human body? And basically, they looked at all of this and threw up their hands. It's too complicated. And trust me, I've had lots of conference calls over the last 18 months with the EPA. Hang on a quick second. With the EPA, and they when we explained to them just the topic of routes of exposure, they just can't believe it. They don't even know what to do with it, and they say, well, they'll call us back. We don't get the phone call, but it's complicated. So we looked at our own local ordinances, and again, I'd encourage you to take a look at what you have for your local authority. We have very broad public health authority in Denver. I think we're unique in Colorado. I'm not sure that there's any other local jurisdiction that has this kind of authority. A lot of local jurisdictions in Colorado enforce state law, so their hands are tied on what they can do. Under our local ordinances, we have broad public health authority. And so once we kind of figured out lines of jurisdiction, what our authority was, that our authority wasn't going to step on the state authority, we needed to act to get these plants out of the stream of commerce and not into the hands of consumers. So we put holds, as you guys know from last year, we put holds on grow facilities last year. We didn't order anything condemned. We were still trying to figure out a way through this. We ended up putting holds on a little over 100,000 plants in 11 different facilities last year. We were sued twice last year. And this was very unique because so the way that pesticide law, and I'm not going to bore you with all of this, but pesticide law, again, starts at the federal level. If I am Dow Industrial, for example, and I want to register Eagle 20 for use on corn, I have to put a bunch of some studies together, human health risk assessments, not just research in books, but studies on animals, those kinds of things. And there's very strict rules about what I need to then submit to the EPA to get my pesticide registered for use on a crop. The EPA nobody's doing that. Dow Industrial isn't going to the EPA saying, I want to register my pesticide for use on marijuana. One, it's very expensive, it's very complicated with the routes of exposure, but also it's federally illegal and nobody's really wanting to step into that space right now, or there's a lot of reluctance to do that. And so there were no human health risk assessments. Nobody knew what was the long-term or short-term impact of pesticides on human beings. So instead of going that route, you have to kind of prove, you as the pesticide proponent needs to be able to prove the health risks to humans. They turned it on its head and said, well, we couldn't prove it's unsafe, therefore they should be able to use whatever they want. That's not how it works. I see, Shay, you're familiar with pesticide law. That's not at all how it works, but that's how the lawsuit went. It was 3 days of testimony and arguing about that fact, about who has to prove it's safe or unsafe. We actually had the Department of Agriculture testified for us. We had 3 toxicologists testify. But the miracle of it all is that we had the EPA actually testify for the very first time in a marijuana case from Washington, D.C., on how all of this really worked. It was a very emotional year. It was a lot of anxiety in the industry. I commend Ashley's team. She's not in here at the moment, but I commend Ashley's team for engaging the industry and getting us through this process, but also them through this process. This was very emotional. I anticipate that if you embark on something like this, you'll have to kind of think about how you work through it, because it wasn't easy. At the end of the day, the judge ruled in favor of Denver that we were absolutely within the scope of our authority to put the holds on these plants to protect public health. As I said, we continue to battle through this. Danica, now his team has moved on to finding edibles that are testing positive for pesticides, concentrates that are testing positive for pesticides. One of the concerns that we learned about through all of this is that when THC is concentrated into the form of an oil, when it's concentrated from the plant into the oil, you're also concentrating the pesticide into that oil. And the extraction methods are actually more efficient at extracting pesticides than they are at extracting THC. I think Commander Henning here said that our crime lab recently was testing marijuana, I think it was a plant, not product, plants, and they found more pesticide on the plant than THC. So I can guarantee with pretty sure confidence that you have a pesticide problem in your jurisdictions. So you need to think about it, you need to think about what you're going to do about it, what your authority is, figure out jurisdiction, because it's going to be different from ours to some extent. Think about all of these things in advance. Engage the industry. They can help get through it, as painful as it was for them. I think we all have learned through this experience. But just some things to think about as you embark on your own adventures. I'm going to turn this over to one of my other attorneys on my team to finish up this portion of our presentation as far as it relates to edibles.
Good afternoon, everyone. My name is Anshul Bagga. I'm an assistant city attorney in prosecution and code enforcement. I work on the marijuana team that Marley was referencing. I have the privilege to work directly under Marley with a team of fantastic other attorneys and paralegals who are sitting right over there. So I've been with the city for about 2 years as an attorney, and in those 2 years, 50% of that was working on the issue that Marley was just talking about, which is pesticide contamination in marijuana. So to just jump right back in, right after the district court case that we were successful with in 2015, we had kind of thought that this issue had been put to bed, that we would not see many more issues related to pesticide contamination in marijuana plants. That didn't turn out to be the case. Like Danica said, in fall of 2015, the Denver Post broke the story about contaminated marijuana edibles, and the Denver Department of Environmental Health always follows up on a complaint. So they started doing the same thing that they did with contaminated marijuana plants, which is issuing hold orders on contaminated marijuana edibles. I think one thing that we learned very quickly after that, and that Danica can definitely attest to, is that it's easier to prevent contamination before it happens rather than contain it after it happens. So after they put the holds on the marijuana edibles, we found out that the challenges were basically the same that we would face in any other pesticide litigation regarding marijuana plants, except for one issue, which is that the complex supply and distribution chain makes it harder to trace back where the contamination happened, and that obviously brings up arguments on the other side where they can point fingers as to where the contamination happened and assign liability to other people. So after we placed holds on the contaminated marijuana edibles, we did have a series of administrative challenges, which we continue to work through, but finally on November 13th, 2015, the governor of Colorado weighed in and said that any marijuana that was contaminated with off-label pesticide use was a threat to public health and had to be removed from the stream of commerce. The state started enforcement action earlier this year, and as of September of this year, they've issued 33 public health safety advisories. I think that the issue of contaminated marijuana edibles is something that we still continue to work through as a city under our public health authority. But if there was one kind of takeaway from the whole pesticide debacle that we've been throughout 2015 is that it's the same thing you've heard over and over again throughout this entire symposium, which is that you want to get in front of these issues and establish these jurisdictional swim lanes before you jump into fully legalizing retail or medical marijuana at any level. And I think that when we were doing some of this pesticide enforcement, we did a survey on other states and what they were doing, and we found that many other states had regulations regarding pesticide use, but very few states had anything regarding what to do with the marijuana once it was contaminated. And like Marley said, generally the federal government will step in if it's food or something like that, and it's released into the stream of commerce, but that's not going to be the case with marijuana. So if there was one takeaway from this whole saga, it's kind of get in front of these issues before they happen in your jurisdiction. And then just to kind of switch gears, another public health issue that we've seen come up regards public consumption clubs or social marijuana clubs. In Colorado, you heard Andrew Friedman say earlier that the state hasn't spoken clearly as to the private club model. The state has said, with regard to public consumption, that open and public marijuana consumption is legal. So Amendment 64, which is the amendment that legalized retail marijuana in Colorado, clearly states that open and public consumption, that nothing in the amendment legalizes open and public consumption. Both the Denver Code and the state criminal code define public as a place where a substantial number of the public has access. But like I said earlier, the issue of private marijuana clubs continues to be an issue. I know that Seattle and the state of Washington and Washington, D.C. have addressed that issue kind of head on the same way that a lot of other jurisdictions in Colorado have, which is that they prohibit private marijuana clubs altogether. But there are other states, for example, Alaska, that has a very similar language in their code regarding marijuana consumption, and it prohibits public consumption, but this language, open to a substantial number of the public, has engendered there's some wiggle room in that language. And I know that in Alaska, for example, the Attorney General released an opinion saying that that doesn't legalize social marijuana consumption clubs, but the legislature in Alaska may not necessarily agree with that. So throughout 2014 and 2015, the Denver Police Department would find many of these private marijuana consumption clubs. And without any clear direction from the state or from our legislature about what to do with private marijuana consumption clubs, we were kind of left with the tools that we had in place. So we decided that we would use the specific statutory tools that we have to address specific public health concerns. So the first thing that we started using was something that I think many states have, and something that Erik is going to talk about later, which is indoor air pollution law. So we have the Colorado Clean Indoor Air Act, and so under that authority, we decided to address specifically indoor air pollution issues. The Colorado Clean Indoor Air Act, though, I think like many other indoor air pollution laws in other states, is not necessarily a silver bullet for these issues because it has similar exemptions for private homes, private automobiles, and even to a certain extent private businesses with certain restrictions. So that doesn't necessarily take care of the problem with regard to private marijuana clubs. You can't private marijuana clubs solely using the Colorado Clean Indoor Air Act necessarily. So I'd encourage you to look at your own clean indoor air laws to see if they have similar exemptions. The Colorado Clean Indoor Air Act also doesn't address e-cigarettes, which could be a public health concern in your jurisdiction, depending on how your environmental department feels about that. Our Colorado Clean Indoor Air Act expressly includes marijuana. That may not be the case in your jurisdiction. But under our Colorado Clean Indoor Air Act, we can address the specific concern regarding indoor air pollution. The other issue with the Colorado Clean Indoor Air Act is that you have to read it in conjunction with other statutes. You may have an open container law in your state, for example. That open container law, if you read it in conjunction with other indoor air pollution laws, you may have it may not be entirely clear how to address things like mobile smoking lounges, something like that. We have a decent amount of mobile smoking lounges in Colorado, and the interplay of those two laws is very important. So the other public consumption, or the other public health issue that we have with regard to these private marijuana clubs is drug driving and polysubstance abuse. So there's pretty clear data out there that says that being impaired by one substance can be amplified if you're impaired by a series of substances. Unlike liquor bars or tasting rooms or something like that, where you have a bartender that can moderate the amount of consumption that the patrons can have, you don't necessarily have that, and you're definitely not going to have that if you don't have any regulations regarding private marijuana clubs. There's no dram shop laws with regard to assigning liability to someone that overserves someone marijuana. So if you don't get in front of this issue and you just leave these places unregulated, you obviously have something else to deal with in terms of increased impairment and drug driving. The other concern is diversion. So in Colorado, pursuant to state law, you can't consume on a premises that is licensed that can sell retail marijuana. Obviously, if you can't sell retail marijuana at the place where you consume the retail marijuana, you're going to have people bringing it. And when you have people bringing large numbers of people bringing marijuana into a place that's not regulated at all, you have concerns about that marijuana being exchanged for money, obviously. This can get amplified if you have lax medical laws, for example. I know that DPD has walked into some places where there's medical cultivation going on, and it's an unregulated private marijuana consumption club, which then brings up the concern of large amounts of marijuana being diverted within the club. So these are concerns I think that all jurisdictions are going to face, and again, the common refrain, get ahead of these issues before they happen in your jurisdiction. I know that especially with public consumption, that this can be a particularly contentious issue, but it's important to have those hard conversations before you pass any sort of legalized retail or medical marijuana, so that you have enforceable and clear public health and safety regulations. And if you don't get ahead of it, there is a possibility that it gets brought to your voters in a more direct way through the form of an initiative or an amendment, which is something that's happening here in Denver. We have a initiated ballot initiative called the Neighborhood Approved Cannabis Consumption Pilot Program. It's been approved for ballot circulation. It'll be on the ballot in November. It allows consumption on the premises of other licensed businesses, so liquor licensed premises would be able to have marijuana consumption under this initiative. Consumption under the initiative has to be in compliance with the Colorado Clean Indoor Air Act, and it would require some sort of permitting regulation. So I think that if this does pass in November, it's likely that Denver will deal with it the same way we've dealt with everything else, with convening stakeholder groups and subject matter experts from other agencies to handle the public health concerns that are posed by these kinds of places. And with that, I guess I'll turn it over to Celia.
So, hi, I'm Celia Vanderloop. I'm with the North Denver Cornerstone Collaborative, and I worked for a long time with the Department of Environmental Health and our Environmental Quality Division. And our Environmental Quality Division enforces our air pollution control laws and also does odor complaints. So let me start by talking a little bit about odors as they relate to marijuana and as they relate to our communities. A lot of times people think odors are not a big deal. All right, can you hear me now? No. Okay. How about this? I'll just hold it. So odors hit people where they live. You and I expect to be able to go into our backyards and have a barbecue or socialize with our friends, things like that. And in the neighborhoods where we have significant odors, and we do have significant odors in the areas where marijuana cultivation facilities are concentrated, marijuana odors are really a significant problem. And especially these odors are concentrated in our lower income communities that live in commercial, industrial, mixed residential areas. So we had approximately 1,300 odor complaints since 2004. And let me riff on that a little bit in terms of, I think that is a vast underestimation of the odor complaints. When I would go out in communities, all kinds of people would say they had complained about odors, and the Department of Environmental Health would have no record of their complaint. And maybe they would have called the wrong jurisdiction, or they would have called their city council office, or they would have talked to somebody else. But and the other thing is, it's pretty well known in some fields that complaints are a bad measure of problems when you're dealing with lower income and minority communities. Often undocumented people don't want to complain, they don't know how to complain, or low-income people don't feel like government is going to respond, and so they don't complain. And there are some studies that show that. So we also did a survey done by a nonprofit partner in which 100% of the Spanish-speaking community surveyed, and 82% of the English speakers reported that they felt stressed because of odors, and that they reported that it affected their quality of life, which I think is pretty significant numbers. So the concerns that they expressed were health effects: headaches, eye and throat irritation, nausea. They didn't enjoy being outside. They had mental stress, and then they were unwilling to socialize. And if you think about what contributes to your quality of life, you want to be able to socialize at your home. The other thing I wanted to say is that odor doesn't respect boundaries. When we did a best practice survey across the nation in terms of how people regulate odors, sometimes people tend to try to address it through zoning. Well, I live about 20 miles from Greeley, where there is a meatpacking plant and feedlot, and I can smell it at my house. You can't zone away Greeley or the meat, well, it's true. So I want to just say, from my personal opinion, zoning is not the answer to addressing odors. So we have chosen to address odors through modeling air pollution laws. Again, I want to stress that we are considering odors a nuisance right now because, as these ladies had pointed out previously, we just don't have the science to demonstrate whether odors are a health hazard or not, but we do have a good deal of data saying that it is a nuisance. So where are our odors? This map, the light blue line there, is the line between Adams County and Denver. And these neighborhoods here, the Global and Elyria Swansea neighborhoods, are the neighborhoods that are in the North Denver Cornerstone Collaborative. And these are the facilities that are most commonly complained about. And as you can see, we get a lot of complaints in Denver about facilities that are 2, 3, 4, 5 miles north of Denver. And then this is a map of where our cultivation facilities are located. And on this, I'm going to get this backward because I can't read it from here. I believe the dark blue are existing facilities and the light blue are proposed facilities. So they're generally located in our lower income communities, but they're also generally located pretty close to where people live. And this is where we get odor concerns when we look at our complaint data, when we look at our survey data, and we look at best practices nationally. So we went through a process. Well, let me step back for a second. We went through a planning process for the neighborhoods that I work in that were neighborhood plans, and we did what's called a health impact assessment. And we identified what are the ways that planning can impact health. And the number one environmental concern raised by these residents was odors. These are people that live in an area that are a lot of industry, there's a major highway coming through, they live near a Superfund site, and their major concern was odors. So again, it's important that we don't say this is not an issue. So we decided we were going to revise our existing odor ordinance. Our existing odor ordinance is modeled after, was modeled after state law, which uses a device called a nasal ranger, and it dilutes, that nasal ranger measures odors by diluting contaminated air by clean air, and if you fail at a dilution threshold of 7:1, you have a violation. Well, in that 1,300 complaints that we had reported before, we had 2 violations. It just doesn't work. We have gone out to marijuana facility boundaries. We have asked our inspectors to qualitatively evaluate odors on a 1 to 5 basis, and actually I think I might be jumping ahead to a slide I have later, but I'm just going to talk about it now. And we had 60% of the facilities where the inspector identified odors was a problem, and a good number of those it was a significant problem, rating 5, and yet none of those facilities failed on the dilution threshold. So what we did is we left the dilution threshold in because that is still the enforceable mechanism under state regulation. We changed our complaint process. We used to have a provision in our ordinance that said if you've received 5 or more complaints from about a particular facility within 12 hours, that was considered a violation. And we expanded that to say 5 or more complaints within 30 days. And we also allowed, it used to just be residents, and now it's residents and businesses and employees. Because in these areas where facilities are located, we have a good number of businesses and employees, and we've heard repeatedly from a business that is located adjacent to a marijuana facility that it really interferes with their ability to do business. The last thing we did was we added in specific industry types, and this is based on the data I showed earlier about what was complained about and what was best practices nationally. And we said those specific industries all had to prepare a proactive odor control plan. So if you fail the dilution threshold, if you have 5 or more complaints within 30 days, or if you are a specific industry type, you have to prepare an odor control plan. And that odor control plan is based on best practices available for odor control for your industry. And again, this is modeled after air pollution control law. It's required on best available control technology rather than a specific performance standard. As these ladies pointed out, marijuana is a new thing. Odors are not well studied. We don't understand what the health impacts of odors are. We don't have the research. So we needed to, and we wanted to treat our facilities like an industry or a regular business that should be a good neighbor, but shouldn't be expected to do more than anybody else should in terms of being a good neighbor. So we expect them to install best available control technology. And that's what our odor control plans require. They submit an odor control plan, they implement their odor control plan, and then we move through compliance monitoring. So here's what's required in an odor control plan. So you're required, as I said, proactively required for specific industries if you fail the dilution threshold, if you have 5 or more complaints within 30 days. And what this means for the marijuana industry is the odor control plan is required. We went and looked at our existing marijuana industries, and we have a good number of facilities out there that already have odor control installed. And the good operators, you can't really tell they're there. Carbon filtration is in use at a good number of facilities, and that carbon filtration is what we have decided is the best available control technology. approximately 50 to 60% of our existing cultivation facilities already have carbon filtration installed. Some of those haven't turned it on because it was not required, but the ones that have turned it on and are using it, it works well. It's also pretty cost effective. For a medium-sized facility, we guesstimate that the cost of installation would be somewhere between $10,000 and $20,000 per year for installation, and then somewhere under a couple $1,000s to $3,000 a year to operate, which we think is fairly cost effective. So then our next step after passing the ordinance this May, and thank you to City Council for passing that, that was great, we went through and developed a rule. And so the purpose, we formed an odor advisory group because we wanted to have affected residents, neighborhoods in a room with the industry, in a room with the technology providers, so that, because none of us are an expert in this field, we're all learning as we go, and we wanted them to establish what's expected in an odor control plan and recommend the industry-specific odor control technologies. And then we also wanted them to develop industry-specific odor control templates. We had 7 advisory group meetings. I was really proud of this process. We conducted them in English and Spanish. This next slide is just participants we had from industry, neighborhood groups, technical groups. You can see Aubrey on there with the elephant, and he said, "Odor's the elephant in the room." And he's one of our representatives from the neighborhood associations. We had a number of monolingual Spanish-speaking participants, and folks really stepped up, and I thought it was a great way to kind of reach some compromises and have people understand where each other were coming from. So that rule overview has, kind of standard stuff: scope, definitions, who the rule applies to. And then here's kind of the heart of the matter. Here's the components that are in that required in an odor control plan. So we require facility information that just gives you the basic information: name, address, owner, things like that. What are the odor sources? Are they a cultivation? Are they a manufacturer of infused products? And then again, we paralleled air pollution regulation, and we divided requirements into administrative controls, meaning processes and procedures such as shutting your doors and windows, or training your staff, that would be required. And then engineering controls, so that is specific engineering things that you change within the building. You have to establish a timeline for installing things, and you have to conduct complaint tracking. And then the next part of the rule is to submit the plan, have a process for the department to approve, and then we also have a variance process. For example, I know we have one facility that is really it's a store, but I think they have one plant and an enclosed glass container, and we really don't think they need to do engineering controls on their enclosed glass container. So we want to have a way where people don't have to do onerous requirements. And then the other thing is they are required to maintain, keep records, and conduct inspections. So, and then the last part I wanted to talk about is we have templates for each type of facility that has required for odor control plans. And those templates identify the best control technologies. They provide additional clarity on the expected content. And then last but not least, we are expecting a chunk of odor control plans in February. We're expecting, perhaps a couple hundred. And so we want to make them as easy as possible for the Department of Environmental Health to review and approve so we can get rolling. And the cultivation template has activated carbon as the best control technology. We decided that because there was a technology requirement, we needed some way of accountability for that system designer, so we're requiring those engineering controls to be signed off by a professional engineer or a certified industrial hygienist, somebody who in essence puts their license on the line if it doesn't work, and then the system design processes and maintenance. And then this here slide is applied to the manufacturers of infused products. This is something we didn't know when we went into this product. If you're a standalone manufacturer of infused products, many of those don't generate smell at all. So if you don't have any of these processes, oil activation, distillation or extraction that is not covered by the fire department, or cultivation processes co-located, if you don't have any of those, you don't need engineering controls. So then it will go through, it will be approved by the Department of Environmental Health. There will be plan approvals from other agencies. There will be purchase and installation of the engineering controls. Then those engineering controls will need to be inspected and approved by the city agencies, and then we expect the facility to be up and running. So there is a resource component of this for the Department of Environmental Health. We need to make sure they have adequate staffing, they have technical expertise, and then we need to ensure that they have databases. As we go through, we expect to collect a lot of data on how these systems are sized and designed so that we are able to know, in the future when we get new plans, what is really in the ballpark of a good plan. The other thing that we're expecting to do is some ongoing public communications. We're going to hold workshops probably in early January on what is expected in those odor control plans. Again, to help the industry move forward and to help us so that they look similar and we know what we're getting. We want to make sure that the industry is aware of what they need to do. And then we will be also holding additional advisory group meetings. One of the things that came out of that advisory group meetings that we were not anticipating is the community, especially the residents, but also the industry, is very interested in developing performance standards for odor control, and the science is just not there yet as far as we know, so we need to kind of really look into that, and we'll be working with our advisory group on that issue as we move forward. So this is a timeline on our next steps as we move forward. I'm not going to talk through that in detail. And then there's some appendix items, but I won't go through those. So I am going to hand it over to Erik, and I'd be happy to stick around and answer any questions you might have. Thank you.
I'm so glad I took a shower this morning, the odor control. There we go. How's everyone doing? We're almost done, and I'm, whoops, the other way. Nope. There we go. You missed a few slides there. I'm Erik. The last time I was in Colorado was in 1993 when I was driving a 1968 Volkswagen bus. But I wasn't a hippie running around looking for my future. I was chasing the Marlboro Adventure Team, who are very active here in Colorado, especially in Denver. And Pope John Paul II was having a big event, so we reached a lot of kids walking to his big event, trying to do prevention issues. I know we haven't talked a lot about prevention, about youth, but I think part of this you can incorporate when you're getting youth involved with your laws in your town. And then I went into Aurora, and we met the Marlboro Adventure Team at a gas station where we shut them down and just took photos of them, embarrassed them. And we went over to Grand Junction where they had their big Marlboro Adventure Team, and they canceled their events. And we did a very little budget with activism and cameras and ridicule. So it's really cool that we have the industry. I don't know if the tobacco industry is in the audience, but we do have the cannabis industry, and this is a new concept for all of us that we're all working together. Not that we're going to sing Kumbaya and do all that, but everyone has their lane to stay in and work on. So I'm very grateful to the city of Denver for inviting me here. I'm going to offer you a little perspective of what's happening in Oregon. Whoops, I'm going the wrong way. This is from the state. I'm just going to give you a little brief overview of Oregon and what you can do in Oregon. A little bit different than some of the, but maybe probably the same. I think we pattern our policy after Denver and Colorado. I like this one with the middle one down at the middle where you can run around with it in the state. Can't leave it. We call it retail. The Oregon Health Authority says we want to call it retail. We're not calling it recreational. There are some exemptions of personal homes, residential backyards, and hotel rooms that allow smoking. There's only 25% that allow that. Who has the Indoor Clean Air Act in their province or city or county or country? Very few. So this is what helps us regulate the rules of use, including indoor and even outdoor. We include inhalants now. So everything from herbal shisha the e-cigarettes, to vaporizers, to marijuana. All this stuff you cannot inhale through a lung. So we call it delivered in the person's respiratory system. So I can't enforce something people eating edibles in a workplace. So just at the beginning of this year, the state made a new rule that you can't do this indoors or within 10 feet of the doors. And we have a little, I brought some if you want to take one, a souvenir home from Oregon. Oh, did I drop it? Well, I have this is a little flyer. I think I have some stickers here that talk about the 10-foot rule. And then the enclosed definitions changed in 2000, right at the beginning of the year too. So it made most patios not able to smoke or use e-cigarettes or marijuana in those public places. Now, marijuana you cannot use in public places anyways, but under my jurisdiction, I can enforce it in the outdoor area. Everyone was looking at everyone like, who's going to enforce it? The Liquor Control Commission, the Oregon Health Authority, the City of Portland, the Fire Marshal. We're all like, okay, who's doing what? And it kind of came down to the state, and the state delegates the enforcement to the county. And it becomes me, little old tobacco guy that's been doing this for years, and marijuana becomes a new thing. But we're just treating it like tobacco in one way. So what used to be a real calm thing, we got it going, we know exactly what we're doing with tobacco, has become a crazy intersection with a lot of moving pieces. And I don't need to bring up a lot of things. I know we want to allow some time for questions. But what I really want to talk about is our protocol. We're real proud of our protocol, which you have to have in place. Because if you step out of line in this, you're not going to have any cases with the Department of Justice if you do shut down a cannabis club, for example. And I'm Mr. Nice Guy. You know, we send a letter to the business. We get a complaint. We never know if they get it or not. Sometimes they call us and say, what's this letter? We get a second complaint. We go do an unannounced visit. And with anything involves marijuana, I bring a partner with me. Not that I'm nervous or anything, but we need to have a couple set of eyes. Media out there, we were just in the paper last week. They're talking about civil liberties and private clubs and all that. So if we do find violations, we explain it. And of course, I'm called the smoking police or Nazi or anti-smoking zealot. And I say, no. You know, my brother calls me a narc now. But I say I'm an educator, you know, and the customers hear me and they go, okay, professor. So it's always like, you know, always something trying to get at me to break me down when I'm out in the field. I'm a public servant just trying to explain the rules. If they have troubles with it, they can contact their commissioner, their state legislator, my boss, a lot of opportunities. They keep saying, well, this is a private club. We've had one club in Portland that says we can do this. You have to have a membership. There are no rules in Oregon for private clubs, so you cannot do this. If we know there's going to be an event like this Sunday, it's called the Dope Cup at an old factory, the state will send them a letter saying, hey, by the way, you're not allowed to do this. But that's all about we can do. It's kind of like, all right, you can't do it, but then they're blowing in from Seattle. They're going to do a one-day event and then leave. So what we're trying to do is build collaboration, communication. My colleagues from the city are here, Portland. We provide a lot of educational materials. Well, this is not dangerous. Secondhand smoke, well, we have some information on secondhand smoke. We have about the state rules. We involve the Office of Neighborhood Involvement when neighbors are concerned about odors or fires or people smoking in their yards. We also work with the Liquor Control Commission. We're also I'm representing the county on the Portland Marijuana Policy Oversight Team, or MPOT for short. And we meet once a month, and we're discussing these various issues, kind of tourism and really equity too. Are we being disparate in any communities for people? And also youth prevention. So since they have complaints, some of the other ones that have had complaints are some workplaces, the boss is smoking pot or vaping pot in the back room, and private events at home. Well, we're doing this in our living room where we invite people to our backyard to do this, but they're charging money. So some gray areas still. And then there's tour buses. I don't know if you have that in Denver, but there's tour buses. They're not allowed to be on the road, and they're doing tours with all that. And then the 420 events in April. And so these are some of the things that we're dealing with. The media really keep piling on the stuff to just get everyone riled up about it all. Almost every week we have ads on our weekly newspaper called the Willamette Week. The world famous Cannabis Club got shut down. I felt really bad. They had a separate standalone where a lot of people with medical marijuana cards were hanging out, and they're part of NORML, and they didn't cause any problems. He said, we're going to close down, abide by the rules, but we're going to come back and fight in January when the legislature starts again. So they have their right. We're doing a lot of Civic 101 kinds of stuff with them. I want to just bring up one other issue before we can take some questions. You got to learn all the vocabulary. I mean, it's new for me. So there's dabbing, volcano. Everyone know what dabbing is? And e-nails, heating up the electronic, hookahs, waxing, and other terminology. So just try to become more learning about it, as I did about the tobacco industry. And I think it's real important that we continue to work with the industry. A lot of them they come to the MPOT meetings. They're represented at the MPOT, and we'll continue to make this all and sing Kumbaya and have all good. So this is where I can be contacted in Portland. If you're ever in Portland, come visit us. It's kind of the Denver of the Northwest with rain. So do we have questions? Probably anyone can address anyone here. Thank you. I do have some stickers here for just 10-foot rules, and then what encloses, so brochures, and then that one-page handout if anyone wants to get that.
Hi.
I'm sorry?
Thanks. Can you hear me okay?
You're the-
I have
No,
a
you're
whole
the
bunch,
Denver
but I
Denver
won't
size.
hog the time. I'll just ask one and I'll wait and I'll get back in line again. But first off, I came in late. Is the PowerPoint going to be available on a website, or is there a way to get the PowerPoint after the fact?
I believe
Probably?
so, yeah.
Okay. If I
It
give
will
someone
be.
a card.
It'll be available.
Great, thank you. On the pesticide issue, my name is Erik Bergman. I work for Colorado counties, all the county governments around the state. I'm curious about the work you're doing on the pesticides, and because Denver being a home rule city, sometimes there's a discrepancy for a lot of my county members who don't have the same grant of authority based on their statutory status. But I know one question I had, though, was on the pesticide issues. One of my counties had an issue with the grower. They had one of the health department or the Department of Ag did a test, found the stuff, froze said they can't sell, and they had to get it all resolved. But they were claiming that it was that they weren't using the pesticide, that it was like there was supposed to be like an organic mulch they were using that obviously wasn't organic. And is that true? Is that possible? I never did find out what this was the claim the industry was making.
Are we all, okay, you can hear me? Oh, so what we've heard are similar things. We've heard, yeah, we're not using it in our facility. So again, all of our grows are indoors. So
Right.
there is a concept called drift in pesticide law. So if Danica's spraying her cornfield and it drifts over onto mine, I didn't do anything wrong. But it's harder to claim that when your whole grow is inside a facility and there's no. So that we had some claims where it was coming in, they say it was coming in through the ductwork. So we've heard those kinds of things. My conversations, lots of conversations with EPA and Department of Ag, is that what we're seeing as far as residue levels, there's no way it's drift. There's no way it's coming off of contamination off of walls or of the mulch types of situations. So we are hearing those things, but it's not borne out by our conversations with the experts. Do you?
And I guess the only other thing I have to add to that is there have been a few compounds that have been labeled one way and then ended up containing off-label ingredients that were not disclosed on the label. And so that has come up in a couple of different situations as well.
Okay. Great. I'll get back in line. Thank you.
Okay.
Hi, my name is Jonathan Teeters. I'm with a company called Tradive. We're a distributor here in Colorado and also in California. where we're going to be working very closely with labs where regulations are currently being developed. My question is, do you have any sort of rules of thumb or things we can look at across the marketplace that help us understand trends as far as we have groups like Focus and ASAPFC, you have Green Clean certification, you have ISO certification for labs. What are some of the big things you're seeing as far as macro trends that help us understand where you're taking the industry or where we can go together, if you will? Because California, they're not trying to rebuild the wheel. They're talking to you guys, I know this, right? So what are some of the big trends that are gonna be bigger that you guys are pioneering that we can look at to kind of, as indicators, if you will?
I can start with this one. That's a broad question, and I don't know that I've got a fantastic answer other than to say that one thing that the city has done and the Office of Marijuana Policy has led us with this is holding regular industry check-in and industry stakeholder groups. And so there's been a lot of really open communication between different regulatory agencies at the city level and the industry about new issues that are coming up. But really, outside of that and watching the media, I think things come up pretty quickly and we follow through on them fairly quickly. So oftentimes we don't know what 6 months down the road is going to hold for us. Anybody else have anything to add to that?
Are you asking from a public health perspective or just in general?
I guess if I was asking from a public health perspective, what could I look at as far as things that are meaningful these days?
Like a resource or something, or?
A resource, or when a lab tells you, oh, we're getting ISO certified, or when a cultivator says we're green clean, and we are organic, somewhat to this guy's question of the mulch, who's creating the standards that may or may not be universal that we can start looking at as meaningful?
I think as far as pesticide and sustainability issues, that there was a separate symposium yesterday that had a lot of industry members involved, probably some of you folks in the room. There's a lot of leadership from the industry, honestly. And I can say, having been in this position now for 3 years and living this, I've learned a lot from the industry. And I would really encourage everyone, I think you've heard this before all day, encourage to build the partnerships with the industry. There's a lot of good folks out there that know a lot. So, you can learn a lot from symposiums like this, but we're still learning too. And the industry can be a great partner in learning what trends are. We've got a lot of things posted on the city websites that can be resources for you. And as Danica said, trends, we're hearing a lot about hemp issues now in Denver, and we're trying to tackle what those might be. But as things come up really quickly, and that is a trend in and of itself. With marijuana, it's moving fast, and we have to keep up with it. I wish I had a better answer, but it's just be quick, be nimble.
Is this on? Yes. So I'm a senior advisor with environmental health up in Canada. And so my portfolio is I do the built side. So I do the healthy homes, I guess. So I'm just wondering, from your guys' point of view, you talked about a lot of the food, but you guys get a lot of, you're talking about the big facilities, but what about the home grows and stuff like that? Does environmental health here deal with those? And then my second question is, you're able to smoke it or consume it private places. What do you guys define as a rental property? Like, is a rental house someone's private residence? I don't know if you guys can speak with that, but I just know, just for seeing it, because it's going to be legalized, that we're going to get a lot of calls because we inspect rental housing. But do you guys define that as someone's private dwelling? I don't know if you can answer that.
I'll take the first one relating to the home grow piece, and I think that there's a lot of different angles to this. Environmental health is sometimes involved if there are complaints that relate to our housing code, and so we might go out there and have an initial presence, an initial response. But if something appears to be an illegal grow based on the numbers, that's very quickly going to come out of the hands of environmental health and go over to the hands of the police department. And in the interest of time, I'll kind of turn it over to Marley to respond to your second question.
So if you're renting a house and that's where you're living, that's considered a private home. What we're seeing, and I know Commander Henning's probably going to touch on this in the next session, but we are battling with home grows right now. It's a big problem. What I have seen are some leases that prohibit marijuana growing in the rental home, and so any landlord is free to put those things in their lease. You still have control over your property, and that house, as a landlord, is still your property. So you are, despite what Amendment 64 says, you can still put that restriction in your lease. And HOAs can do similar things, that kind of thing. But if there's nothing in the lease and I'm renting the property, then that is private property.
So I would add, just from an odor perspective, a grow that's in a home is no different than a grow that is in a commercial area. If it's bothering its neighbor, it needs to comply with the law.
We're at time, but I think we can go over just about 5 minutes. There is another session in here that's starting in 15 minutes. So let's go back to the rear one.
Good afternoon. John Apple with Senegal Police Department. As you don't know, California is probably on the verge of passing it. But I had two questions. One is a quick one. The big lawsuit you had with those two collectives that sued, any chance or any word if they're going to be appealing that, or is that going to be a done deal?
So two grows sued us last year for the holds on the plants. We litigated one to the very end, and then ultimately they withdrew their lawsuit and destroyed the product, the plants, and so did the other one. They didn't go as far. We have had two more with the edibles and the concentrates holds that we've been doing since fall of last year that have filed petitions before the Board of Environmental Health. That's kind of a precursor to the lawsuit. One of them has since pulled their petition and destroyed that product. We have one still that's open before the Board of Environmental Health. So the three that have pulled the lawsuits, they're done. They haven't appealed it further. We still have that one open one that's still
And I
in
guess the
flux.
primary thing is, I know one of your slides, you talked about the executive order that was signed by the governor about the exceptions for use of marijuana. One of them was a private vehicle. I know in California, and I'm pretty sure Colorado, they both abide by the TA 21, which talks about open containers in a vehicle. And I know it specifically states alcohol, but does Colorado consider a vehicle parked on a public street, a public place? But I noticed that one of the exceptions talks about a private automobile, so I'm kind of confused by.
So just really quickly, we're out of time, so I just want to answer it pretty quickly. If you're in your private vehicle and you're smoking in your private vehicle, that would be an open container similar to drinking a bottle of beer in your car. You could be cited for that. There is an exception under our Colorado Clean Indoor Air Act and under our traffic laws for limousines for hire. So if I hire a limousine and I'm coming in from the airport, there is this strange exception. And I say strange because we have now this concept where there's no pot club per se where you can smoke it, but then we have these vans and we see them limos and buses that are traveling around Denver, and they're perfectly legal to be smoking up in there. And the tours that you guys went on yesterday, some of those allow the smoking on those buses during their normal tours. I'm sure yesterday they didn't, but maybe they did.
Okay, and I think we've got time for one more question in the front here.
Hi, I'm Peter O'Shiro from the state of Hawaii. We just legalized dispensaries in 2016. My program does the food side, and my program does also the pesticide sampling for raw agricultural commodities. Your MCLs were established based on ingestion of products, raw agricultural commodities. Is that what I heard? The maximum contamination levels for pesticides?
At this point in time, our messaging to the industry is that there should not be any
Okay.
contamination
So zero
of product.
tolerance. Okay.
That being said, if there is we do take each case and evaluate it on a case-by-case basis. And my team works really closely with Marley's. We want to be able to defend ourselves if we take action. So that's kind of the why we conduct that evaluation. But generally, zero tolerance for any of those contaminants.
No, I really want to commend you guys, city, for getting involved in this. This is an awesome paradigm shift that you guys went into. And for the MCLs also, I have actually 87 more questions, but for your MCL issue also, was there any comparison between the tobacco industry and the marijuana industry as far as what they use for their mold and fungicides? Thanks.
For their mold levels or their tolerance levels for pesticides? So there are no tolerance. Tolerance means for certain food things that are intended for human consumption, there's a level of pesticide that's considered safe for human consumption depending on what the pesticide is and what the food is. And so certain numbers have been set by the EPA. They're very low. there's no tolerance level set for tobacco because it's considered inherently bad for you. So they just don't bother. They figure that tobacco's going to kill you anyway. So there are tolerance levels set in Europe and elsewhere, but not here in the States. Yeah, I know.
May I
One more.
sneak in one last question? Hi, I'm Terry from Department of Public Health, Environmental Health Division in the County of Los Angeles. Danica, do you, when you do your inspections, since it's the same division as your food safety program, do you actually score or grade the facilities like many of us do for our restaurants? And if so, do you publish those scores on your website?
Good question. So in Denver, we do not have a grading system per se. However, we do make all of the inspection reports, including the comments from our investigators, available on our website, www.denvergov.org/food-safety. And so the marijuana facility inspections are up there as well.
Thank you.
Thank you so much, everybody.